Wonderful. Katie, do you wanna go ahead and get us started?
Sure. So welcome everybody to the call, and thanks to all of the colleagues from the communities and two NGO delegations to the Global Fund Board who have joined us today. As many of you know, there was the 50th, actually, number 50 of the board meeting for the Global Fund that took place the middle of this month. I've already forgotten what dates, but I was there. Um, and it was a lot of interesting conversations. So we're going to just share a few top line reflections from us here at GFAN, and then we're going to pass it over to our colleagues from the delegations to give their sort of thoughts. This call, we tend to, we always record our calls, but we also try to keep the chat fairly lively. And there's a lot of acronyms and short forms that are used when we talk about board stuff. So don't hesitate to sort of ask in the chat if you don't know what TRP or something like that is, because it's helpful for us to remember to sound things out, but also there's lots of people on this call who can answer and help us all sort of learn together. What I will say is, I think I went back and figured it was the 15th or 16th board meeting that I've attended on behalf of GFAN, and I still think that I learn something, at least one thing, if not 10 new things every time I go to a board meeting. So don't hesitate to use the chat to be asking those questions as we're going through these updates, okay? Just really quick reflections from GFAN's side, and I'll ask Conte, who's also busy letting people in. There we go. Just to say that I think I had mentioned ahead of the board meeting on one of these calls that there was a bit of a new sort of structure to the agenda. We spent a full day as excuse me, as delegates to the board, kind of going through what was in the technical review panel's review of funding requests, what was known in terms of the latest epidemiology and statistics around the diseases, what was planned in the strategy around the three diseases and for this next cycle of implementation. And we spent a whole day listening to the board members kind of go through parts of that and look ahead to what was happening, what was in the funding requests, where the gaps were, and what some of the issues, challenges, problems were with that, and where maybe board members felt like there were opportunities to do a little bit better. So that's quite a different structure, at least for the ones I've been to. I haven't seen something like that. And there was a big discussion around a number of sort of key issues around the risks around malaria with stalling progress and sort of multiple threats. We talked about health and climate, I think for the first time as a dedicated kind of topic at the board meeting. And of course, it was also the fall meeting. And so we had the annual Community Rights and Gender report, as well as a lot of things which, to be honest, before I joined the board, I really didn't reflect on in terms of there being, important around governance issues, around the evaluation functions of the Global Fund, which has just gone through a tremendous change in terms of how the work of the Global Fund and its grantees or recipients of funds are evaluated in terms of making progress against the strategy. So those were sort of some of the key decisions or key discussions, apologies. There were a number of key decisions, including approving the proposed operating budget for the Secretariat for the next year, and a number of other decisions, but none of them were how do you say this? They were all more operational than they were thematic or strategic kinds of decisions that were made. At least in my opinion, you may hear from the delegations that there were some that were a bit more important strategically than I'm aware of. There were a few sort of key themes that seemed to be, while they weren't on the board agenda, they seemed to come up a lot. And one of those was the future of global health initiatives, which came up sort of throughout the conversations, both in the board meeting as well as outside of the board meeting. And if you remember, that future of global health initiatives, or FGHI, that we often shorten it to, is sort of this effort that's been taking place this year that's been led by Norway and Kenya, I'm hoping maybe Rwanda, sorry, and that's being led by those two countries to talk about different ways in which the global health institutions would maybe need to adjust some of their work to try and make the costs on implementing countries and implementers less complicated, but also to try and make sure that we're taking advantage of the work of the health institutions and making sure that they're collaborating and not duplicating. So there is this sort of, and I think, yes, there we go. Masaki is correcting me in the chat, so thank you, Masaki. So there was this sort of overlap of this issue because it's coming to its conclusion. There was a meeting this week in Lusaka around the FGHI. It's planned to be sort of finalized by the end of this year. So there was an awful lot of comments about the FGHI and what different members of the board felt should be discussed or how the Global Fund should approach this. But I think overall, the main sort of concerns that we've shared before were listened to, were well understood around the FGHI process, that the process itself was pretty bad, and that the global health institutions themselves need to be, their boards need to be the ones that are deciding how to take forward some of these ideas and some of these initiatives. So that's kind of my sort of top line reflections. Conte, who joined a board meeting in person for the first time, I'm not sure if you had anything else to add from our side before we pass it over to the delegations.
Sorry, I realized I moved the slide inadvertently. No, I think that's covered. That's covered everything that I would have highlighted. Yeah. A lot of, sorry, the one thing that was mentioned a few times across different topics was the successes of the market, the next gen market shaping strategy, with a lot of time spent by the Secretariat highlighting drops in prices across key communities and strengthening of supply chains, which was interesting.
Very interesting. And one of those areas where I think through the FGHI process, there are some who are looking for better collaboration between the fund and others, other institutions on that. So we're going to start with our colleagues from the communities delegation. And just to say, we will, I'm not sure if we've shared it yet in advance of this call, but we do have an updated sort of this is what the board looks like document that we have where we mention who everyone is that's representing civil society and communities at the board in its different structures, both at the board table and the committees and in some other structures. So we will be sharing that again, if we haven't already. But that lets me welcome Javier, who has been sitting as the board member for the communities delegation for a while, but also Jean-Paul from the communities delegation, who has been a member of the delegation for a while, but also sitting as the alternate board member for the first time at this board meeting. So Javier, over to you for some reflections. And then after that, we will go to colleagues from the Developing Countries NGO, and come back to all of you with questions. So Javier.
Thank you, Katie, and thank you to the GFAN family. I would like to introduce Jean-Paul, our alternate board member, who will be sharing with you all a very short reflections on key points. Jean-Paul.
Thank you very much. I'm Jean-Paul, like you say, I'm Jean-Paul Nama. I work for Coalition Plus in Senegal as advocacy officer, and I've been member of the community delegation since 2020, and it's my first time, also my first time to attend a board meeting as an alternate board member. So community delegation at the 50th Global Fund board meeting. In a brief, we will have four items where I will share what we have been, what was our position around CCM, looking ahead, blended financing, climate and health, and also around youth council. Javier will add if something is missing, we'll add after my presentation. So talking about CCM, our position, we have advocated for the creation of a CCM working group with linkage to the Ethics and Governance Committee and Strategic Committee. It's something we have advocated with some other constituency like 1/7, and I think also England have take a position also like us, but we will follow this if in the next couple of time, if something it can be favorable for the next for the next year. And we are also talk about the sustainability of CCM, what will happen beyond the transition to move to strategic initiative to the OPEX, to OPEX, how will CCM will be included in these new structures. And we are also questioning the use of the 50% dedicated to the CCM. How can communities benefited from them? Is it for salaries? Sometimes or some CCM uses for to pay salaries of the secretariat, but we question, is it for the meaningful involvement of community around the CCM's process, taking into account that in some country it's not easy for community to be engaged, key population especially. We have a lot of cases like in Nigeria, like in Kyrgyzstan last time. So we have questioned how the CCM use this 50% of the fund allocated to them. We have also questioned the fact that when it's come to conflict of interest, why is only communities who are targeted to disclose a conflict of interest, not government? That is something we are very curious to know what is happening about that. And we have also mentioned the place of youth, because we are during this board meeting, we have 3 days. We visited the youth council. It's in our constituency. We include a statement about youth, the place of youth in the whole architecture of global funds. And yes, we and also around CCM. So is there a seat for them? We don't really know. There are some few CCM who have a seat for youth in their country, but it's not something which is formalized. According when it's to looking ahead to the grant cycle 7, we have mentioned the delay in meeting target for HIV, TB, and malaria, which can lead to other issues such as criminalizations of key populations, corruption, nepotism, and sometimes power imbalance and incompetences of people who are sometimes recruited to do cycle. And we have also mentioned the fact that it's important to hold the government accountable to issues like criminalization, marginalization. Since we are in area of anti-rights movement, we have a lot of effects on the 3 diseases. And we have also mentioned the fact that it's important that community have their proper funds, not outside the dual track financing to create movements of social change and address injustices. We also mentioned here the importance of creating partnership to find solutions and to challenge prevention to mother to child, drug resistance, and TB and malaria investment, and alarm to trade off, which sometimes should not undermine the priority of community. And our concern on the rise of, like I've mentioned previously, anti-gender movement around the world and its impact on the 3 diseases. We also questioned the fact that during the TRP, during the application review, there was an annex for community. How useful the annex was for was it useful or useless to them? So just to know about the TRP perspective. And for global fund approach to blended financing, in a whole, we agree to this approach, we have understand the need to mobilize other sources of funding to complement the actual gap existed, but we remain concerned if community are included in the operationalization of this process, because we know that we have done a lot of feedback with the finance team, and they have included our input, but now we don't know if one of our community constituency is included in the process of operationalization. So it's something we are yes. And at the end, talking about climate and health, it's a good thing that we have a standalone item in the agenda. It was very appreciated, but we wondering if it will be important to have a clear strategy who can address the impact of climate on health, and where we see the exact role of community. But until now, we can just see that community are involved as to do basic prevention. But now we are talking about community certain system. It's important that we include all the yes. Like we have done with COVID-19 pandemic, it's important also that we strengthen community health system so that we can also deal with climate, the impact of climate on health. Like I've mentioned here previously, we have a position paper who have a statement about the exact place of youth within the Global Fund architecture. We recommend every civil society. We have recommended, it's something we have done also, to include them as a member. If we cannot have a proper structure of youth within the Global Fund strategy architecture, it will be important that we, as a delegation, we include sometime in our delegation. We have two and a half. I'm not very young, but I think that we have young people in our delegation. So we always consult them what is the priority of youth during our activities. So it's something we recommend. So that's all by our side. I don't know if Xavier can share about other items very quickly, because I know that we have only 8 minutes. I just take some important point to share with you. Thank you very much.
Thank you, Jean-Paul. Very quickly, if we do have time during this call to discuss the future of global health institution and an extra board seat, that's things that have been raised, or we can have an additional call later. Thank you very much, Jean-Paul.
Great. We are hoping to have a debrief on the FGHI post the conclusion of the Lusaka conference, which is where it's currently being discussed. But we can talk more about that. And yes, around the board seat, Javier, good flag. Catherine, who is from the developed country NGO delegation, and sat for the first time in her position as alternate board member. So Catherine, over to you. And thank you for sharing thoughts from the the developed country NGO delegation, which is also my delegation.
We're all friends here. We're all in alignment. But thanks, Katie. And apologies to the group. I brought some COVID back from Geneva with me. I'm feeling much better, but I do sound a little raspy, so apologies. And I didn't put anything into slides, but I promise I'll speak slow. And luckily, as you'll hear, I think that the communities delegations, as well as developed and developing, really saw a lot of the same things during the board meeting, actually worked very closely together to align ourselves where we felt very strongly on the same things. I just want to start off quickly with sort of just an overall impression from the board meeting. I think Katie touched on a lot of this, but it was a very full meeting in the fact that there was a lot to talk about. And I think that we really got a sense of the real challenges that are facing the fund right now, and the seriousness with which, having to deal with funding gaps and whatnot is being met. And so while the decisions were fairly operational, I will note some things that we thought were important in there. It does feel like this board meeting was pretty unique in that it was really meant to bring everyone to sort of be on the same page and see the same things and understand the challenges as a group, not just under piecemeal agenda items. So we heard like some things that jumped out at me, how often we heard the word trade-offs, throughout the meeting, there's discussions about we can't do everything. What can we do? We heard in many different agenda items about the deteriorating human rights space. It wasn't just limited to when we talked about CRG, it was kind of everywhere. And so, as I said, I felt like this was a board meeting where these major challenges are being recognized more fully, and not just as a performance indicator or as a governance indicator, but really sort of what's being faced as a whole. Also, as Katie kind of mentioned, I thought it was interesting that, having this sort of one day where we got to talk about the TRP review and also looking ahead on the grant cycle. Oftentimes we as board members don't necessarily get to interject on specific performance indicators or disease specific challenges we see. And it was an interesting opportunity to have interventions just on TB, just on HIV, just on malaria, versus having to address those things under a sort of a governance subtopic. So I think it really added a robustness to the conversation. And I think, as the communities noted in their slides, about sort of where we're seeing performance gaps, where indicators are falling behind, where certain communities or populations or subgroups aren't being addressed, and also the weaknesses in the proposals. Still, we don't always get to talk about, even when we know there's something to do, maybe the proposals aren't strong enough. And then finally, obviously, sort of what falls out of the proposals during negotiation. We didn't get to talk about that as much as we probably would have later on, since some of these things are still being negotiated. But many of us know that, the trickiest part of the Global Fund model is, the proposals come in, then you have to align funding to the proposals. And often many really important things that our delegations particularly care about don't always get into the final award. And so I think that was recognized, and probably will need further discussion down the road. So those are kind of like just big sort of themes and feelings, I guess, I had. I want to hit on a couple of things, and you'll hear some similarities, but our delegation really went in with the other delegations, community groups, about human rights. And I mentioned the deteriorating space and the feeling that this is just becoming more and more challenging, and particularly for the Global Fund, where we know the diseases have a disproportionate impact on populations that are often facing these human rights, anti-rights movements, and increased violence and humanitarian crises. So, we really brought that conversation in where we could, not just about dedicating funding for human rights, which I think was really emphasized in the CRG component, but also really trying to focus on the safety and security aspects of the environment we're seeing around human rights. And, we recommended a situation room to look more closely at how safety and security measures are being integrated into country allocations. We also talked a lot about flexibilities to address these sort of emerging environments that we're seeing. And then we also very specifically called on the Global Fund to conduct a deep dive on digitalization and how it's could impact human rights. Where we're particularly concerned, we think the Global Fund's done a lot on digitalization, but considering that the sort of deteriorating environment, have they looked at the real privacy concerns? Have they looked at how data and digital security is being advanced in conflict zones, in areas of surveillance states? So we'll be following up on that after the meeting. Briefly, I want to talk on malaria and climate change. I think the communities group covered this quite well. There's a real sort of focus on flexibilities and this massive funding gap on malaria. I will say, from my opinion, first time in the chair, I don't think I realized exactly how dire the situation on malaria was with the $1 billion funding gap. And I think it is a really kind of jarring example of how climate change is going to impact, one of the three major areas of Global Fund work. So it was an interesting conversation that really focused on, again, flexibilities and innovative approaches, especially in challenging operating environments. It was pointed out that there are currently humanitarian crises in 37 malaria endemic countries. So when you think about these overlapping challenges, I think malaria really helped us all understand that. And we also talked a lot about prioritizing the role of community health workers and strong community systems, particularly with malaria. I think it was the communities colleagues who really pointed out that when you look at sort of some of the failings in malaria and reaching our goals, it's 90% of the funding goes to commodities. Where are we really creating the demand creation? Where are we changing community viewpoints on malaria? And that was sort of jumped out really clearly. You know, we on the blended finance, I just want to try to jump ahead a little bit. I thought was a really strong opportunity, and I think everyone sort of felt like, you know, where there's opportunities to blend finance, we should take them. I think our delegation really wanted to see a little more clarity on the sort of how this would work, not just permission to work. One of our delegation members actually even said, like, but where does this money come from? Like, we're blending money, but like, we don't have a pocket of money. We're talking about trade-offs. So where's this money coming from? So I think we're really looking forward to sort of understanding how these type of blended finances opportunities are going to come to fruition, and sort of see that come through. I want to also reiterate some of the stuff on the country coordinating mechanisms. There's been a lot of work done by Global Fund to try to strengthen the country coordinating mechanisms, but they're kind of in a transition period, right, as that budget moves to the operating budget of the Secretariat. And so I think they're much like our communities colleagues. We feel like there's a lot that we need to pay attention to there, and that we as a delegation would like to see the EGC committee, so ethics, government, no, I'm going to get that wrong, ever at EGC. Someone will type it in the chat. We would like to see EGC take more responsibility of sort of making sure from a governance standpoint that, you know, that the CCMs are meeting the mandates that they have. Someone is paying attention to making sure that civil society and affected communities are well represented, as a community colleague said, just to keep improving on what the improvements have happened already. And then I'm going to kind of try to wrap up, so I'm repeating other people's stuff. But I think, you know, we also supported a review of the sustainability transition and co-financing policy. Our delegation felt like with so many waivers that have happened over the past several years, there was a need to kind of look at the policy. I think there's some concerns that any review of the policy has a predetermined outcome, and we got many reassurances that that was not the case, but we're going to have to keep an eye on that. But it was a sense that with all these pushes to enhance domestic funding and all the concerns that this funding isn't going to go into the hands of key and vulnerable population human rights, we need to kind of understand where this policy is working, how it's working, before we try to make any changes to it. And then finally, I have two more things to say. My colleagues didn't bring up the advocacy roadmap. I think the developed country NGO delegation, by virtue of working with developed countries, has a lot of interest in how we raise resources for the Global Fund from donor nations. And we really tried to emphasize in our interventions that the work isn't done on the current replenishment. And, you know, that's going to really set the tone for the next replenishment. And so I think, you know, we'd like to see some more emphasis on kind of getting more money in the coffers for this grant cycle. And then really looking ahead to the next, you know, I think the advocacy roadmap, for those of you who haven't seen it, I'm sure someone will put it in the chat. But, you know, it really recognizes the importance of civil society, not just for a replenishment period, but in between replenishment period. Like, how does civil society drive attention, drive innovation? How does it keep the Global Fund and its mission as a centerpiece of global health year after year after year, not just when it's time to ask for pledges? And so I think we really want to recognize that and to really see and challenge people to invest in that. And then finally, just want to reiterate the comment about PMTCT that the committee's made. It was really nice. It kind of came up in the sort of the grant cycle 7 review, but you know, I think our delegations recognize that we consistently see sort of poor outcomes and poor indicator on children's issues across the 3 diseases. And so I think we really challenged the Secretariat to really think about what they do there, not just from a performance standard, from an equity standpoint, that the pediatric indicators seem to be so far behind. And there are many delegations at the table who sort of responded to that. It was in our written statement, and we also said at the table. So we're hopeful to see where that goes. I'm sure I'm leaving off stuff. I apologize to members of my delegation on this call who will grade me later. But hopefully that gives you a snapshot of what we took to the table, what we heard in the room, and happy to answer questions as we go along.
Thanks, Catherine. No, I think you did, speaking as a member of your delegation, you did a great job summing up there and a great job sitting at the table for the first time. So thank you for that. And thank you for raising the advocacy roadmap and some of those side conversations around resource mobilization that it may or may not have been me who was pushing our delegation along on. So I will now pass it on to Cecilia from the Developing Countries NGO delegation, who's sitting as board member still and has been for about a year now, I think. So Cecilia, over to you, unless I'm mistaken and that got changed overnight. Are you there?
Hi, Katie. Sophie.
Sorry, Sophie.
I don't think Cecilia is online. I think I dropped you a message just to say she's really struggling in Lusaka with internet. So I think I'm going to present the delegation.
Okay. I'm so sorry, Sophie. I didn't see that before getting on the call. Apologies. So over to Sophie, the delightful communications focal point for the Developing Country NGO delegation. Sophie, over to you.
And I think I'm joined from my delegation by Andre. So Andre, I might ask you to just chime in if I miss anything. So just wanted to start by saying thanks to GFAN for organizing the space and the other two delegations. It was really good to work closely with the other two delegations. We had a lot of our pre-constituency meetings together and really appreciated working closely this time, which was different. I also just wanted to start with the board agenda. I think, as Katie said, it was structured a bit differently this time, and there was a lot more of a push from the board chairs to ask board members to stop reading talking points and actually just engage in a conversation. So that's how the board agenda was structured this time around, instead of looking at specific documents on their own. We did hear from the TRP as a pre-session, as was said. I'm going to try not to repeat anything that was said, so I'm going to add different stuff. So just to add, and they reported back on Windows 1 and Windows 2, and they have reviewed in total 105 funding requests and recommended just 9.68 billion in allocation funds for the grant making, which is 73% of all allocated funds. And what's interesting of that is that in addition to that, the prioritized above allocation requests of unfunded quality demand was 5 billion. So that's a really huge gap, just showing, that this is the largest amount of money that was spent ever within the history of the Global Fund. And there's a huge amount of prioritized above allocation. As was said, a lot's been discussed around GC7. What else should I add to this? On HIV, as Catherine said, a lot of concern was raised around human rights as an outstanding challenge and a real barrier to us being able to end HIV. Not enough is being done to address stigma and discrimination that people continue to experience in healthcare settings, the shrinking civil society space, the lack of gender transformative programming, the lack of accurate data population size estimates, especially for key populations and adolescent girls and young women, that's disaggregated by age and sex, that's collected, that's verified by communities. And it's just crazy that we're still not seeing this, that we still don't have what we need. And we've been calling for it for so long. On TB, it's just not enough money. 1/3 of people with TB still do not have access to rapid molecular diagnostics, timely and accurate diagnosis. And so we really called for engagement and adequate funding of civil society and communities to increase in terms of access and coverage, important data that would allow for more tailored responses to really reach the most vulnerable and marginalized folks. And then really reaching people, especially in contexts of increasing conflict and natural disasters. In malaria, as Catherine said, it's really scary, and we should all be very concerned about what's happening with malaria. We had a joint perspective here with the other two delegations, and really the message was that the malaria agenda needs to be owned by communities and civil society, and that we're missing as part of the solution. There needs to be a lot more investment in strengthening capacity of civil society to deliver. And within the context of climate change, as disasters happen more and more, communities on the ground really need to be strong, because they're the first ones who are going to be able to respond. there was a lot of discussion around migration. With climate change, people are on the move. And that's an important area because so many people are moving around. We're going to miss people. And again, community engagement is also really important to help deal with the vaccine hesitancy that's going to come from the new malaria vaccines that are being rolled out. In terms of the quality assurance policies, just to explain a bit, the quality assurance is really ensuring that health products, from everything that the Global Fund procures, from medications to microscopes, is safe, effective, good quality, and that it actually reaches people. So there's been this global shift from the stringent regulatory authority to the WHO listed authority, which was something that member states had called for to ensure a more transparent, evidence-based pathway for regulatory authorities operating at an advanced level. So this is a policy shift at the global level that the Global Fund is having to adjust its policies to be able to fit into this shift. So our delegation really welcomed this eligibility because it's going to be able to allow us to access more diverse medications, greater regional production and access, improve readiness in emergencies. And we see this as one step closer to actually decolonializing the health and development agenda. In terms of the risk appetite, the Global Fund thinks about the work that they do in terms of, how much risk does it carry for them to be able to deliver their mandate. And so within this discussion, the risk around malaria has increased from high risk to very high. And so that required some discussion at the board table. It's not a good picture. There's drug and insecticide resistance, climate change, bringing new mosquitoes that bite during the day. So more incidents and death in natural disasters. As Catherine said, a gap of $1 billion, and just inability to provide early diagnostics, treatment, and accurate reporting. So we really called for robust risk management within this, timeline to bring the risk down. More conversations with WHO about how we can ensure that the vaccines become more efficacious and have better tools for malaria. And then we requested more information on community-led monitoring within the malaria response and how that's being used to drive social accountability. Around blended financing, it's a little bit complicated, but just to explain to everyone, it's how the Global Fund combines grants with other sources of financing, including investments from development and finance institutions. So it's things like debt to health swaps, leveraging different kinds of funding approaches, and using increased investments at the national level for health. So we share the concerns with the communities and the developed delegation, and really urge the Global Fund to test different implementation models, including with civil society and communities as they roll this out. And that this isn't just going to be something that should sit with the Global Fund, but it should sit across the whole partnership. There was a lot of discussion at this board meeting around sustainability and co-financing, and it's something that kept popping up along with the FGHI discussion. And the sustainability transition and co-financing policy was approved by the Global Fund in 2016, and there's been a lot that's changed since then. But it is a really important policy in terms of what happens when countries also transition out of the Global Fund, and how do they sustain eventually, how do they stand on their own 2 feet? And there were some very different perspectives around the board table. Some wanted a review of the SDC policy, some were not wanting the review, and some were saying that if a review was to happen, it needed to be a clear and transparent process, and not just be seen as an extra strategy for some donors, given the tight fiscal space that we're all operating in. Katie, please just let me know if I'm over speaking. I think I've got a couple more points. On the CCMs, sorry, shall I stop?
No. Keep going, but try to wrap up quickly so we do have some time for discussion. Thank you.
On the CCMs, just to give you a bit of background to the discussion that's already been said, the Strategy Committee and the Ethics and Governance Committee and the Secretariat had put together a working group. And they had kind of 4 key areas of concern that they've been discussing, the CCMs, and they kind of grouped them into issues around representation, decision-making, differentiation, and monitoring. So these areas were discussed at the board meeting. And we had supported, I think we supported the community's delegation in their call for funding to engage civil society, especially around that 15% that goes to the CCM as part of the funding, but that's specifically supposed to go to community engagement, but it often gets dwindled down to pocket change. And then an additional ask for direct funding to communities, so that CCMs can be resilient and ensure CSOs and communities are able to operate meaningfully in that space, especially in humanitarian crises. So we're looking forward to seeing more from that working group, because we need a lot more work to be done on the CCM so that they are fit for purpose. Around climate change, I mean, there's no doubt that climate change exacerbates inequalities and vulnerabilities across HIV, TB, and much, much more for malaria. Around this, I think from what we heard, the takeaway conversations were that the takeaways from the conversations were that the Global Fund should not lose focus on its mandate, but they should really be clear about their comparative advantages as they remain focused on HIV, TB, and malaria. But climate change is something that they have to now deal with as they deliver their mandate. We requested the Global Fund to work with civil society and communities and really start to make very clear links between human rights, inequalities, and climate change. And then a framework. We need a framework and a metric to measure impact and actions. And let's be clear about where the Global Fund is going to take a leading role and where they're going to take a supportive role. And within that, there was a lot of conversation around migration. And the last point I'll just come back to is the Youth Council, which Jean-Paul already touched on. This was created in January 2020, and I think this was the first time that they've come together. I think they started moving in the ship before they realized where they're going, but it's a really important initiative, and we hope that they will be able to integrate it into the Global Fund architecture as at the global level, but as well as the national level, where there are just not enough young people represented on CCMs. And our delegation is committed to speaking with the Youth Council before each board meeting to solicit their advice on key agenda items. So I'll stop there, Katie. Thank you.
Thank you. And yeah, thanks for bringing us back around to the Youth Council, because it really was an interesting conversation. And some of that work went across various conversations that we all had, I think, as delegations. So it was great to meet them and see them in person and having had their first meeting. So I would just, other than Robin, who is putting in many lovely comments into the chat, I'm not seeing about how wonderful the report back is, so, and which I echo, just wanting to open it up to anybody else for sort of any questions or comments that you might have. And I'm just remembering, Javier, that you had also raised the issue around the proposal to add a board seat. And so we can come back to that if that doesn't come up sort of in the questions. But please use the raise hand function, or just let us know through the chat if you're having trouble finding it that you wanted to raise something, or if you're somewhere where you can't speak or unmute, please just put your question in the chat. So I see Robin with her hand raised, so I'll go to you first, Robin. Go ahead, please.
Thanks so much, Katie. Thanks, everybody. Really, really great report back. One question, just to come back around grant making and the allocation of funds for window 1 and 2, and hopefully soon window 3 as well. Was there clarity about how much money is actually making it to communities and to key population-led interventions? with communities being at the center of this strategy, that really, I think, needs to be a focus, and we really need to keep an eye on the resources. And often it's difficult to get that kind of data from the Global Fund Secretariat. So just really curious whether or not that was teased out, either in the discussion or in-room presentations, or any promised follow-up. Thanks.
I'll just take Pernilla's question as well and then go back to delegation colleagues if they have something that they can add in on that. I've got one point on that, Robin, but Pernilla, did you want to go ahead?
Yes, thank you. Also, a huge thank you from me to everyone who reported back. This is super useful. I just have a question of clarification to what Sophie was saying of the 5 billion of unfunded quality demand in above allocation requests. Does that mean that there's up to 5 billion in above allocation requests that are of quality, but that cannot be funded? Is that understood correctly? I can see Katie is nodding, so I will take that as a yes. Thank you.
That is unfortunately what is happening, meaning that there's already $5 billion of quality proposals from around the world that cannot be implemented with Global Fund money. And our experience with the UPD over the last few years has not been great in terms of the ability to raise money against that, which I think is what Catherine was trying to raise as well, in terms of like the work around resource mobilization for this period is not done yet, not just because we didn't meet the 18 billion target, but because we know there's an awful lot of good proposals out there that could be funded that probably won't be funded, or at least won't be funded through the Global Fund, but I suspect won't be funded at all. I don't know, Javier, I saw you turn your camera on. Did you want to come in on any of those points?
Yeah, thank you, Robin. And in terms of raising this issue around resources and data, I think that probably the three delegations also were quite outspoken that we don't want to see, for example, the investment on community health workers to continue training people. We want these resources to be used for paying all these people. I think the Global Fund architecture for malaria, TB, and HIV has been relying on a lot of volunteer people, but I think in principle recipients or large sub-recipients, some of the technocrats are very well paid and contributing to their retirement package, etc., etc. So it's not only an issue of equity, but it's also an issue of sustainability, that community health workers and community systems are properly funded, not only to continue doing training workshop, but also get a proper salary. In terms of the unfunded quality demand, of course, it's very concerning, the size of 5 billion. Some of these in the TRP has been pushed back into the main budget. But I mean, this is basically the large outcome. The reality is that there is some percentage of inability to absorb the resources that will be approved for countries. So hopefully the Global Fund Secretariat will be looking into those so-called efficiencies and probably moving some of the unfunded quality demand into the main project. It's something that the three of us, as the three civil society delegations, need to follow up very closely, because it is very important. We should be mindful that we always push TCMs and principal recipients to put on record the unfunded quality demand, because at least we do have something to follow up and understanding what is the priority activities that will not be funded by the grant cycle 7. But I'm happy to hear my colleagues on the other two delegations. Thank you.
Yeah, Catherine or Sophie or Andre, did you want to come in?
I don't have much to add. I mean, going to Robin's question, I don't remember them having a breakdown at this point of how much funding was going to communities. As you said, it's kind of hard, but I also don't think they're in the point in the process where they would share that anyway. I think we're just at the TRP reflections. I would encourage people to look at the TRP reflections. It may not give you a percentage, but it very much tells you, it illuminates the type of proposals they're getting and that have some of that and the weaknesses. Again, I think the community annex is a great point that was brought up by one of the presenters, is that, some of the things, I think that steps to improve the proposals around the community side haven't really manifested. So unfortunately, I don't think we have a breakdown of funding yet, but we'll keep an eye on that. And then sorry, go ahead. I heard somebody. Go ahead, Sophie.
No, sorry, Catherine, I was talking to my son.
Fair enough. All right. That works too. And then I just wanted to, there's a comment about the STC policy. And I think there's a really kind of important thing there. There was, it's one of these things where as a discussion moves on, I think the word choices were being both selective and sneaky at the same time. I don't have a better way to put it with my fever brain, but it started off as a review and then people quickly jumped to revision. And I think there was some people who really want to see a two-step process, right? Like we have to review the policy to decide if we need to make rescissions, and other people are just saying review and revise. And so I do think this is something that was discussed, and the more people discussed, I think the lack of, even though people agreed in principle, the details really started to matter very quickly. And so I think in the notes you'll see that it has gone more to the secretary is considering what committee should look at it and what a review would look like. So there wasn't any decision made. I think there are a number of delegations would really like to see a review. There are a number of delegations like to see a revision, and that's why you review it. So I think this is something we're gonna have to be very sensitive to moving ahead.
Yeah. Sophie, did you want to jump in? Your hand's raised.
Thanks. Just to add on a few things. So around what do we know about how much money is going to communities? We don't really. I think it's something we need to keep asking, and we did ask that, but we need to be really loud about understanding that. We've heard from previous webinars with Claudia on GFAN and with the delegation that about 30% of the funding is going to communities and civil society, but that has not been broken down. So, when we say civil society, which civil society? Is it international NGOs? So we need to understand, of that, how many are key populations, how many are young? And I think that's the information we need to understand. Going back to the STC, when they presented the policy, it was on the back of really understanding where some of the challenges have been. So, and having put in place some real responses to address those challenges. So the Global Fund, is aware where it needs to be strengthened, and they're already doing that, which is why our delegation didn't feel like at this point in time we need to open up and do a full review. But it was clear that there was a lot of underlying stuff not being said at the table, and it wasn't clear. As Catherine said, there's no decision point, so we wait to see how it all unfolds. With the TRP, if someone hasn't already dropped it in there, I would strongly urge you to go and read the TRP report. It's on the website. I'll drop the link if it's not there. But there's a lot of amazing stuff in there that you won't really find anywhere else, that really can support advocacy. Thank you.
Yeah, please do share that link, Sophie, because I'm not seeing the TRP report yet from this past board meeting, but maybe there's another one and I'm just not thinking correctly. So if you can share that link, that would be great. One thing that I would mention, which is kind of an aside to all of this, so just bear with me for a second, but I understand that the CRG department within the Global Fund, the Community Rights and Gender Department, is launching a survey next week to help them understand better sort of the satisfaction of communities' engagement in the funding request development for countries, because this is a new key performance indicator for the new strategy. And there's a call tomorrow to explain sort of what this survey is about and what this work is about. I don't have the invitation. Somebody else here may have it, but we will track it down and share that information over the GFAN listserv. But just to say, an explanatory call is supposed to be happening tomorrow, Thursday the 30th at 2 p.m. Geneva time. And that next week, I believe on the 4th, they're going to be launching this survey to gather that data from communities directly about sort of satisfaction. And hopefully this is around both the funding requests and allocation letters, grant making process, and then grant implementation as well. So which we don't know yet. But so this is, I think, an annual thing that will be happening going forward, and a really important forum to be raising some of these issues. I see two more hands raised. So I'm going to go first to Blessy and then to Asia, and come back to others. Blessy, please.
Thank you so much, Katie, and thanks for all the update from colleagues. Been very, very helpful. I just wanted to make a comment about the funding allocation for communities. In a Global Fund report 2020-2022, if you calculate the amount that is mentioned there, it comes to 0.0126%. And that is extremely low. I can put the link to the report in the chat. I hope I'm seeing it correctly, but 0.016% is awfully low, and is of concern, if I have done my math correctly. And also, I think the other thing is, even funding that goes to large organizations, international global entities, somehow comes under community funding. But what would be important is to see how much of that is actually going to the people at the ground level, to the communities at the ground level. So just two things to flag with concerns regarding funding for communities. And Katie, yes, we do have the invite for the survey. I'm happy to send it across to you. Thank you. Over.
Thanks, Blessy. I'm just sharing the email that I have now with the delegation leadership from delegations here on the call, so that they're aware. Asia, over to you.
Thanks, Asia Russell from Health Gap, and thanks for the report backs. Two quick questions. One, in the context of talking about PPPR and engagement with the three pandemics and the future of the Global Fund, did anyone raise the ongoing highly deadly Mpox, sorry for the background noise, outbreak taking place in DRC that's disproportionately affecting gay and bisexual men and other men who have sex with men and sex workers? 581 people have died so far, and Global Fund grant resources have been investing for years in the three diseases, and now has an Mpox, technical note. So I'm just wondering if that came up among board delegations at all. And then second, in the human rights space discussions, again, sorry for the background noise, the Global Fund is a little bit unique in that it's directly funding, for example, in the case of Uganda, as well as other places, the governments that are promulgating criminalization and increased criminalization and enforcement of criminalization. Did, in the engagement in this area, did any board member raise that specific concern, the specific fact that, unlike largely speaking PEPFAR and other funders, the Global Fund, for example, in its gender initiatives, is funding ministries that are actively promoting hate and criminalization? And did anyone table alternative proposals that have been used before by the Global Fund, for example, reprogramming, which has been done in the case of corruption? Thanks.
Thanks, Asia. So I think you can see in the chat that, as far as any of us are aware, we did not hear mention of the Mpox in DRC issue. So that's a really helpful flag, I think. I certainly did not as well. And then in terms of the secondary issue around Uganda, I mean, there was a lot of discussion around LGBTQ+ issues, and, Uganda was either directly or indirectly referenced, let's say, a number of times, but I am not sure that there was a proposal to bring sort of any kind of change to how funding is utilized. And so I'm just looking to Catherine and Javier, who are like shaking and adding their heads, and Sophie, who's put her hand up, and wondering if there was anything you wanted to add about, ways in which maybe we could take this forward. Sophie?
So around the reprogramming, I think the Global Fund started reprogramming very early on when this happened in Uganda. So they've already started that. They've started focusing on safety and security of people who are affected by these laws. So Asia, I think there's a lot going on, but it's all in the background, and they are not making a lot of noise about what they're doing. And they have said that's their strategy, and they feel they can get a lot more done that way than in a way that we would perhaps all like to see. But in discussions, and it came up a lot, there's always this sense of there's only so much we can do as the Global Fund, and we can't make governments change laws. Like, there's only so much we can do. And so you hear that a lot as well. But there is something, they have put something together. I'm not sure how public it is, so we'll go back and check. But I remember seeing something in their CIG report about a tool that they've put together to address these kinds of situations, because it's not just Uganda, it's happening, and it's been happening. So I'll see if that's shareable, and then we can share that as well.
Go ahead, Javier.
Yeah, very quickly, because I need to leave the call. Apologies for that. I think, as I agree with what was mentioned by Sophie, I think we need to follow up on the Mpox outbreak in DRC. Wasn't the case during the board meeting and wasn't mentioned at all. So this is a recent development, at least for some of us. So we need to follow up on that. And I think that the Global Fund Secretariat and some donors continue to using the diplomatic voice image for whatever is happening in Uganda. We have been informed around many things that's happening now, which are not public. We are not happy with how things are. We believe that should be or could be better. So we will continue looking into that, into Uganda and other countries who are linked to that. Please contact us directly, the 3 delegations, so we can see what we can do better. Thank you. Sorry I need to leave. Bye.
Thanks, Javier. And I've just put into the chat, Asia, I'm just wondering if it would be possible to pull together a conversation so that we could, maybe there's some other colleagues who've been on the board for longer that we could reach out to as well and talk about some of the ways that the delegations have pushed in the past for the Global Fund to be still doing something about these kinds of situations, and not just all behind the doors or behind scenes. I'm not sure what the right thing is. So if that's helpful, then I will reach out after this call and just copy in a bunch of people and see where we can take that from there, because I think that's a really important flag. And I also wasn't aware of really any sort of ways in which the Global Fund had used some flexibilities or used some different ways to work on those before. So thanks for raising that, Asia, and seeing a lot of people talking about the Mpox and how to share information on that. So thanks for that. So we're over the hour, so apologies to everyone who probably has another call to get to and is already late for that. But thank you very much for joining today. We will be, Conte is very deep into finalizing our GFAN board report, where we go into a fair amount of detail on some of these key issues from our perspective, sitting at the board as an observer, as well as participating in some delegation conversations. So we are hoping to get that out next week. So stay tuned. The recording from this call will be available on our website. And Conte, were there any other quick announcements that we wanted to make before letting everyone go today?
No, just to invite everyone to join us in 2 weeks for last call of the year. We'll be discussing. We'll be having a COP debrief, and we'll hear from the Honor Institute, which is launching a report on the criminalization of same-sex sexuality. Yep.
Okay, everyone. So thank you very much. We'll be following up on some of the information, getting information about that explanatory call tomorrow ahead of the survey on community satisfaction within the sort of funding request process. And as soon as we see some of these documents coming up on the Global Fund Board website from the last board meeting, we'll be making sure to draw your attention to those as well. So thank you to our colleagues from all of the delegations who spoke today. It's much appreciated. Thanks to everyone for joining, and keep in touch as always, and have a good rest of your day wherever you are. Thank you.
Thank you.
Bye, everyone.